A hospital is an institution for healthcare, typically providing specialized treatment for the patient. But how does a hospital care for its medical waste? As early in the morning, a lot of patients and relatives of these patients are going in and out, while others are waiting for their queue. The Hospital ng Angeles or ONA was established way back in 1965, and it was meant to be a government hospital for the poor. While it was able to do its job, it would suffer degradation over time, and would lead to the rebuilding and rechristening to the Rafael Lazatin Memorial Medical Center. The previous mayor of the city named it to his father, Rafael Lazatin.
Pare, naman palaking kaya eh. Yung solid base ka naman eh. Kaya kaya ng medical kahit na.
Medical waste at kaya tamong
stay. Nandiyan ang mga pong kaya.
Kaya kung mga pinapungkarel.
According to World Health Organization, the total amount of waste generated by healthcare activities, about 85% is general, non-hazardous waste. The remaining 15% is considered hazardous material that may be infectious, toxic, or radioactive. Every year, an estimated 16 billion injections are administered worldwide, but not all of the needles and syringes are properly disposed of afterwards. Healthcare waste contains potentially harmful microorganisms, which can infect hospital patients, health workers, and the general public. Healthcare activities protect and restore health and save lives. But what about the waste and byproducts they generate? Infectious waste. Waste contaminated with blood and other bodily fluids from discarded diagnostic samples, culture and stocks, or infectious agents from laboratory work. Waste from autopsies and other infected animals from laboratories, or waste from patient in isolation wards and equipment, swabs, bandages, and disposable medical devices. Sharps are considered as the most hazardous waste generated in HCF and must be managed with utmost care. This is because of the double danger it poses. Example of sharps include needles, syringes, scalpels, saw, blades, broken glass, infusion sets, knives, nails, and any other items that can cause a cut or puncture wounds.
Ginagamit na blade for operation yan. Yan. Pag-open ng wound o nung anumang klaseng surgery, yan ang pinag-iiwan ganyan. Ngayon, pag nagamit yan, siyempre, ang gagawin namin, i-dispose kung saan siya nararapat na ilagay. At pag na-dispose namin, nalagay namin ito dun sa tamang lalagyan, siyempre, responsibility naman ng clinical na kunin yan. Yan. Sa nakikita ninyo ng mga lalagyan. Siyempre, hindi naman natin basta-basta ilalagay kung saan yan. Baka magamit nila, masugat sila. Ang inopera ay mayroong infection o ano. Mayroon siyang hepatitis o gano'n. Pagkatapos sugat ka o baka magkaroon ka rin ng sakit. O ano mga nakakaawa na mga sakit. Yan. So ito, ang gagawin nito niyan, ilalagay dyan. Pero gagamitin ko ito pangtasan ng kuwan dahil hindi ko ng kuwan, no? Gagamitin ko pantasan ng lapis, sayang. Sayang, pwede gumagamit.
Yung pong plunger, saan po yun?
Yung plunger naman, kung baga sa aringgilya, hindi naman ako syringe. Syringe. At ito ay 5 ml. May kanya-kanyang mga size yan na ginagamit pang injection. Kung bubuksan natin, ipipil natin dito yan. Siyempre, yan na yan. Pag ginagamit yan, siyempre, binubuksan natin yung cup, inaalis natin yung cup. Ngayon, kung siyempre mayroong mga vials dyan, distilled water, o kaya mga gamot na gusto nating i-dissolve yung powder ng antibiotics, kukuha tayo sa distilled water, pagkatapos ilalagay doon. Siyempre, pag nagamit na ito yung karayom, yung sharp. Yung sharp na ito, may injection ka dito. Kung nagamit sa pasyente na infectious, o pagkatapos na kung sa'yo, o may tendency na maawa ka.
Pathological waste consists of tissues, organs, body parts, blood, body fluids, other waste from surgery and autopsies, including human fetuses and animal carcasses. Recognizable human or animal body parts are also called anatomical waste. Pharmaceutical waste includes expired, split, and contaminated pharmaceutical products, drugs, vaccines, and sera that are no longer required and need to be disposed of appropriately. This category also includes discarded items used in handling of pharmaceuticals such as bottles or boxes with residues, gloves, masks, connective tubing, and drug vials. The hospital segregates its medical waste part by part according to the label of the container. Each container has a label. The housekeeping head assists us to meet the nurses in the second floor of the building and had an interview with Nurse Maria Nina Yalong.
Meron pa silang laman. Pero dahil nga, kung ilan lang yung kailangan na dose, yun lang yung binibigay namin. So, after that, then, tatapon na namin. Tapos, yung infectious namin, meron siyang another container pa. Infectious namin contains yung IV bottle at saka yung mismong IV set. Hindi ko na kami. Wala hindi. Nasa labas. Bali, meron kaming tatlong lalagyan. Meron para sa biodegradable, non-biodegradable, at saka infectious. Lahat ng infectious doon. Basta lahat ng containing blood, ano pa ba? Lahat ng liquid.
The next step in management of hospital waste is treatment and disposal. For this, a separate unit has been established at KGMU which is dedicated to this process.
We concentrated on developing the site for the collection and terminal disposal. This is our central collection and treatment site. The site has recently been developed and is specifically dedicated for the collection and then final disposal of the waste which is collected from the hospital. So this is a very big hospital, and the waste from the various workstations of the hospital comes in these rickshaw trolleys. And then the waste is deloaded into the various areas of this building. The trolley which is containing the infectious waste that comes to this place, and the waste is deloaded from this door. So this is our infectious waste room where we store our infectious waste. So all the infectious waste which comes in red and yellow bags is stored in this room. And here you can see there are two sort of trolleys. One is for incinerable waste, where we store our yellow bags in which we segregate the incinerable waste, and which is finally loaded into this We weigh the bags here on this scale, and then it's loaded onto the vehicle which comes from the CTF, the Central Treatment Facility, which is Synergy right now, with which we have the contract.
The red-colored bags are stored separate from yellow bags for autoclaving. These bags are weighed and a record maintained.
And the bags from this trolley, they are brought to the autoclave machine. These are the two autoclave machines which are used for sterilizing the plastic and the recyclable waste. And in these machines, the bags are loaded first. After being autoclaved, these bags are stored into this trolley. These bags are then taken into this room. This is our segregation room. Here the different categories of the plastics are being segregated into different groups, like gloves, pipes, syringes, cannulas. They are all separated into different categories. These are two shredder machines which are used for shredding the plastic material. So the different categories of plastics are being shredded separately here, so that then they are finally packed and resold.
Similar operations are conducted on the autoclave at GJ Multiclave, which is a common treatment facility or CTF outside of the limits of Chennai city. On this visit of Mr. Edward, Global Project Consultant, he proceeds to test the autoclave machine for its efficacy.
All right, what we're going to do here is set up a data tracers and biological indicators to evaluate an autoclave. And there you have your data tracer, your biological indicator, and your integrator.
He attaches bioindicators to a stick and puts them into the waste bags that are to be autoclaved. At the end of the autoclave cycle, the indicators are removed and put in an incubator, at the end of which the results are noted and the efficacy of the operation is evaluated. The sharps waste is perhaps the most hazardous waste that needs to be handled carefully to avoid incidences of needle prick injury. The sharps waste is collected in the puncture-proof hub cutter boxes, and these containers are directly sent for autoclaving and disposal to the CCTS. One of the methods of sharps waste disposal after autoclaving is by way of sharps pits, as is followed at GJ Multiclave.